Everyone ready? Oh, 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 watch it.
Get closer to you. There we go.
Have I got these stuff? That's okay.
I just turned it off.
Yeah, I'm like,
So sorry about that.
no, that's okay. All right. Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and today I'm joined by Mayor McNamara. And I thank him for his leadership of our municipality, our largest municipality in Winnebago County, the city of Rockford. A little bit about vaccination updates. I know this has been a very exciting week. We had lots of announcements that came out regarding COVID that give us a real sense of hope and optimism. Winnebago County continues to work through completion of Phase 1A vaccinations. And I remind the community, because people say, can we get really to 1B? We're a large employer base, and we continue to vaccinate as more individuals are coming into Phase 1A, including in-home caretakers, family care members that are part of different services through the Departments of Human Services. So we continue with 1A is my point. And we're working to vaccinate residents of what we call Community Integrated Living Arrangements, or CILAs. Between all systems in our community, over 15,000 doses have been administered to date, and over approximately 5,000 individuals have completed the 2 vaccination series. When you go to the Illinois Department of Public Health dashboard, it reflects vaccination by residency. So I want you to know we're vaccinating a lot of individuals that live outside of our community but work in our community as part of our healthcare systems, as part of our essential businesses. And this is an important function because it's not just about it being an insular community. We're a much larger and expansive employer base, as well as a destination for many individuals for their health care and for other goods and services in our county. Working with our healthcare systems, we continue to want to provide collectively 5,000 vaccinations per week. And I remind everyone, these are your community providers. These are your health systems. Crusader Community Health, Marathon Health, Mercy Health, Oak Street Health System, OSF St. Anthony, Swedish American Health System, including their Better Life Wellness Group, UI Health, Miles Square, and the Winnebago County Health Department. I often say that there is no one vaccination. People say, well, is there one big clinic we can all go to? Well, our vaccines are spread out through all these different providers to effectively provide the vaccination to the most at-risk populations. It becomes important to understand that if you're a healthcare provider who's willing to vaccinate community members, please reach out through our COVID-19 hotline or register as a Medical Reserve Corps volunteer. This is truly an all hands on deck. We are your community, your neighbors, your friends, your colleagues, and we are working hard to vaccinate all of you. So we also heard on Monday we transitioned to Phase 1B, which included one of the largest population groups of ages 65 and over. So in addition to the age category, though, we have that, what we call that frontline workers, those essential workers. That includes our first responders that were not part of Phase 1A, such as fire, law enforcement, 911, security personnel. Our education, we are gearing up our schools for in-school vaccination of our teachers and the staff that work in schools and bus drivers and all the aides and all the people that facilitate learning for our children. Food and agriculture. We have over 15 different food processing plants in Winnebago County alone. So those become those centers that we need to vaccinate as our essential frontline workers. Selected manufacturers, corrections, including our Winnebago County Jail, that includes both the staff that work that as well as the detainees and the inmates. Our postal service workers, our public transit workers such as Rockford Mass Transit, Uber, and Lyft drivers. These are essential services that we have relied on throughout the pandemic. Who can not forget our grocery store workers who have really kind of been the ones on the front line since day one and never really backed down. So think of our large grocery store and shelters and adult daycare. As a large area, we also provide a significant amount of service to our homeless population. So places like the Rockford Rescue Mission and Carpenter's Place and other sites, we are going to be working to vaccinate our vulnerable populations. Our health system partners will focus on their enrolled patients 65 years of age and older. Most will be using their electronic health record, or what we call the electronic medical record, or EMR, to reach out to eligible individuals. But I'm going to caution the public, do not call your doctor's office or hospital to schedule a vaccination. They will reach out to you. They know how to get in contact with you. It's important to understand that vaccinations will be only provided by appointment. There are no walk-ins. We, as the health department, will be working with vaccination entities to frontline workers so that they can continue to remain on duty in their work environment, such as the grocery stores, the schools, the food processing plants, and manufacturers. So as we say, we talk about this all the time. We've planned, we're pivoting as we get more information, as we understand more about vaccination and who's in what groups, and now patients, of course. But transition to phase 1B does not mean tomorrow. And I want to reiterate clearly, no entity is providing walk-in vaccinations. Do not walk into a pharmacy. Do not walk into your doctor's office. Do not walk into the health department. We are not providing walk-in vaccinations. Why? Because we made a commitment early on to the equity lens and making sure that those most at risk were receiving the vaccine in a timely manner and being offered that. And every system is working through that process. Also being mindful, when you start talking about over 65 and what we call the frontline essential workers, that represents approximately 2/3 of our population in Winnebago County. So if you have registered on our system, understand that we will be looking at your occupation, we will be looking at your age, we'll be looking at your healthcare risk factors, and also the zip code, because we are committed to making sure that those at highest risk for disease burden are vaccinated in a timely manner. So please be patient. I haven't got my appointment yet. You may not have been scheduled yet because you haven't risen to that level of priority. Everyone is important, but we, again, with limited quantities of vaccine, limited vaccinator staff, we have to prioritize within priorities. So remember that the same healthcare workforce that has cared for you throughout this pandemic have shifted to provide vaccination. And every 3 to 4 weeks, we have to replicate the operations because until we get a vaccine that's only one single dose, we have to give you a second dose for that to be effective, because we want that high protection rate of 95% or more. We've talked before about these vaccines having their logistical challenges, which is why you just can't walk in and I can't just give it to you immediately, is because these vaccines have certain shelf life, storage requirements. But we've said before, our pharmacy teams have really helped us. Both good news on this, they produced the bonus doses. So all clinics are working not to waste. And a dose may be given out of phase to ensure that all vaccine is administered. And healthcare providers are working to make sure that they have that list of, we call the on deck, right? So if there's an extra dose, who do they call in the on deck? And counties throughout the state of Illinois, and even our partnering counties in the state of Wisconsin, are at different phases based on their populations. Larger municipalities, such as Rockford in our area, we have more employment considerations than we do other rural communities, but we will get to everyone. But I want to remind everyone again, and I'm going to reiterate, you should not be charged for registering or making an appointment. You should not provide your social security number, and you should not be asked your immigration status. This is a marathon, not a sprint. So during this marathon, we're going to continue to wear our face coverings when outside of our household. We're going to continue to practice social distancing, wash our hands frequently, stay home when we're sick, and we're going to limit and be intentional about our contacts. Because now we've moved to phase 4 in the Restore Illinois plan. So we've got phases of vaccination, we've come out of mitigations of the tiers, and now phase 4. And I call it patience and restraint. We're excited to be able to move to phase 4 of the Restore Illinois plan. We talked about this last time we met. October 3rd, we've been in mitigation since October 3rd. So we've got a return of indoor dining. We can again have some meetings and social gathering. We have some resumption of competitive sports, the reopening of our museums, a restoration of our theaters and performing arts, and social gatherings. But there are limitations. And so we have to be very thoughtful and continue to monitor the data. Occupancy limits are in existence, so 50 guests or 50% of overall room capacity. Group size limits. Face coverings and masks are required, and social distancing of a minimum of 6 feet. We have to continue to be vigilant to prevent transmission in the community. And we must be ready to address any increase in cases, increase in positivity rate, or hospitalizations associated with COVID. So we're cautiously optimistic, we have to be vigilant, and we have to proceed slowly and carefully because we do not want to have to step back. So today we're reporting new cases, 55 new cases. Our total case count is 25,952. Our positivity rate for 7 days has dropped to 5.6%. Unfortunately, though, we have one additional death to report. And again, we mourn with their family for the loss of that individual. And we've lost almost 400 residents at 395 residents to COVID-19. No new locations of concern are being reported, and Walter Lawson should be congratulated. They've completed 2 incubation periods without any new cases. So we applaud the hard work of that staff as well. So with that, I'd like to turn it over to Mayor McNamara.
Thank you, Dr. for your leadership and the entire team at Winnebago County Health Department. There's a lot of people behind the scenes, and that helps support Dr. Martell, and we're fortunate to have each and every one of them to help us fight the pandemic. So, as Dr. Martell said, locally we are a bit encouraged with some better news, lower positivity rates. As she just mentioned, 5.6% is actually dramatically better than we've been in months, which is phenomenal news. And we are obviously very happy to be moving into phase 4. It shows that the steady progress that we've made in this battle against COVID-19. In the big picture, that phase 4 allow for many more businesses and organizations that now begin to open up to have people in some capacity. A small sense of normalcy back to their lives and for their employees and their patrons. We're also seeing a decline in COVID-19 patients being served in our hospitals, and as Dr. Martell just mentioned, now more than 15,000 vaccinations have been implemented. That includes about 10,000 of our local healthcare workers who, as everyone understands, is some of the hardest working people that we have during this pandemic, and we truly appreciate the work of all of our healthcare staff. Also want to thank all of those in the community who continue to take this very seriously and are doing everything that they can to help protect themselves and their families and ensure that they're healthy. This has really been difficult for every single person in our community. If you own a business or you happen to be unemployed due to the pandemic and the mitigations, this is difficult on everyone. And if you've sacrificed large sacrifices or small sacrifices, I truly appreciate the sacrifices that you have made, and I know that our local healthcare professionals, our first responders, share that appreciation and gratitude for the sacrifices that you're making. And please know that those small or large sacrifices that you're making are helping our entire community in the long run as we fight the pandemic. With that being said, we still know there are literally thousands of people in our community who are really struggling. Right now, I just want to say if you are struggling and in your house there is violence, there may be domestic violence taking place in your home, we are here to help you. I'd urge you to please contact the Family Peace Center. Their phone number is 779-348-7600. That's 779-348-7600. We also understand with COVID-19 and the pandemic and the mitigations and the economic downturn, so many people in our community are really struggling to pay their utility bills. In Rockford alone, we have now helped 7,148 households pay their utility bills to the tune of about $5.7 million of assistance. we are here to help you if you are currently struggling with your utility bills. We do not want you to get behind on those bills. So you can certainly call on the City of Rockford to make an appointment. I would urge you to make an appointment on Friday mornings beginning at 8 a.m. with our city staff, and you can reach out to them by calling 844-710-6919, 844-710-6919. Another area that families are really struggling is paying their rent and mortgage. Obviously, we know that there's this, we've heard a lot about it, this impending foreclosure crisis. City of Rockford's trying to get ahead of that, and we have funds available to help individuals and households pay their rent or mortgage. To date, we have helped over 880 families pay their rent and mortgage to the tune of nearly $1 million. And I would ask, Monday through Friday, 8 a.m. to 5 p.m., please, if you are behind on your rent and mortgage, reach out to the City of Rockford, and you can call the same number I just repeated, which is 844-710-6919. With that being said, we know that we are making progress. We know it's a bit slower than we all would like, and we know that we also have a long way to go before we are entirely through this pandemic. Throughout all of this, I think one thing that's been consistent, Dr. Martell and I have both been incredibly candid with the information we know, and we're going to continue to do that. And in that same sense, I want to say, I too am very excited that we are in phase 4. However, I would be lying to you if I didn't say I'm a little bit fearful as well. I think there is a tendency after having practice social distancing. If you don't have to dine in and you can get food out, do that. If you don't have to shop inside the store and you can pick it up, with curbside pickup, do that. Limit those interactions so that we can continue the pace that we're going with reducing that positivity rate. Obviously, whenever we have to come up here and announce the tragic loss of life, another life lost, now nearly 400 people. That seriously, your own health, your family's health, and all of our health. We don't want to be one of those states or one of those regions who move backwards. We've been there, we've done that. I don't want to do it again. I know no one else does. So please continue to stay focused and continue to take care of one another, and now we'll take questions.
I would say that the two-part question for myself.
Okay.
Just talking about that priority of vaccination, would you say that the health department is maybe focusing on first responders, grocery workers, that list you gave, and then clinics focusing more on 65 and older residents?
The question is the health department focused on that frontline essential worker group, and are the health system partners focused on the over 65? And the answer is yes. And the reason for that is they encounter these individuals and they care for them and their chronic conditions on a regular basis. We also felt it would be most expeditious and efficient for them to be able to vaccinate their patient populations and let us focus on these frontline essential workers that are out having to work and really can't always get away to get a vaccine in a clinic during the day.
Now, Illinois is a bit behind with administering the vaccine compared to other states. If you could kind of comment on that and where we stand compared to others, and why is that?
The question is, how do we compare with other states? Well, I'll be honest, I stay focused within my county and my region. I think the challenge has been, without a national approach, that each state has come up with its own plan. And then depending upon how the authorities and how the health departments within that state function, then the plans can even look a little bit different. And I've been upfront with you that our plan has to be different, right, than, let's say, a neighboring county that isn't a regional employer, doesn't have 3 healthcare systems. Our Phase 1A group is much larger because this is where people come for their health care. Now, that doesn't mean there aren't challenges that are different in a more rural type community, but we have to understand that that is a regional difference. That's what makes our area vibrant. It makes it one that attracts people to the region, but it also makes it more challenging. I share very similar feelings and sentiments with my colleague in the city of Chicago about what that's like to try and be able to be a large municipal employer, group. We have lots of people that come into our area. I've heard, well, do we only vaccinate Winnebago County? And we have said from the start, if you come in, you work in Winnebago County, you live in Winnebago County, we will vaccinate. So when you see the IDPH report, it is where you live. But I want to be clear, we're vaccinating well over that because healthcare workers come from all over. We're a destination for people to come and be employed. So I think the challenge is, again, understanding those strategies, where we're at, and who's included in Phase 1B. Phase 1B, when you go to over 65 versus a 75 or something, that changes the layout as well. So in this state, we understood that some of our younger, again, minority community people of color were being impacted at a younger age. And so therefore they increased, or decreased the age, which increased Phase 1B.
If there was a national approach, how do you think that would affect the rollout of vaccines?
So how would I think a national approach? Again, I think first of all, we'd all be responding consistently. We would understand who's priority for vaccination, how that would roll out, the allocations based on the states, in terms of based on the priority groups. I think those all kind of feed into, remember, it's a national asset. I've talked about this being a federal asset. The state's allocations are based from the national. So with the national, we'd have a better kind of sense, and again, states with more population, with higher risk populations, higher disease burdens, might be prioritized differently than states with less.
Dr. Martell, you had talked about how Winnebago County is getting 5,000 doses for the week. We do know that the Biden administration has said that the state, so IDPH, will get an understanding of how many doses 3 weeks ahead of time. Has that happened for us? Do you know 3 weeks from now what doses we'll be getting?
So the question is, the Biden administration is committed to more proactive reporting of vaccine to be received in a region. We have not seen that come through yet from the state, but I'm sure the state partners are working to make sure that occurs, because I think that is very difficult. Because again, planning, I come back to any of us who've ever planned for a party where we have to have an RSVP and we're going to defrost a certain amount of food, right, or purchase. We need to know what we're going to have to work with. So can I invite 10 people or can I invite 20 people? And you manage that in your households. We have to manage it with vaccine. And I know that's a hard concept to kind of explain that I think we're not used to it. We saw it earlier with PPE and all that, but this is a limited resource at this particular time. But I am confident that they will continue to be able to ramp up production and be able to provide us with the vaccine we need to vaccinate the entire population.
And then Phase 1B did start this week on Monday. Do we have a number or an understanding of how many in Phase 1B have been vaccinated yet so far? The
question is, do we know who's in which phase and which group? And the answer is no, we don't have that solid number. And again, because I could be over 65 and I could also be a healthcare worker. So I think that there's some I'm going to say there are going to have to be some people that do that data, because again, many of our frontline workers may also be in the age category as well. And so again, parsing each of those out is a challenge.
You had talked a little bit about the registration for Winnebago Health, the department here, and how that works. But we also have other municipalities like Walgreens, like Mercy, other people that have that kind of same thing of registering and then getting an appointment. If there are people who are registering at multiple municipalities, how do you think that should work as far as if they do get notified before the other one?
And again, the question is, again, we know there are multiple registration systems out. Again, without a national strategy and picture, everyone really had to plan for their own regional approach. And so now you see Walgreens having a registration system, we have a registration system, another county may have another registration. I think I know that there's been some thinking, should they only register on one system? Can they register on multiple? I don't think it hurts to have redundancy from an emergency preparedness perspective, so register on as many systems as are appropriate for you to register on. And then again, when your opportunity comes up, please get vaccinated. Sometimes I'm kind of amazed the number of people want vaccination. We offer appointment and they say that's not a good time. And, and I come back to, well, everything's different in a pandemic. Let's face it, none of this has been a good time, right? Many of us have had to change plans. We have had weddings that couldn't occur, funerals that couldn't occur, events that couldn't take off. And I say, we've got to make this a good time. So when you get that call or you get that appointment, whatever the system is, take advantage of that appointment. That vaccine has been reserved for you at that appointment.
And then just to follow up with that, so if somebody does register with the health department, and then let's just say Walgreens as well, they end up getting Walgreens first, what should they do about the health department's appointment that was made?
Well, if it goes out, they can cancel it, right? They can, when it comes back up, we have also added now, because so many others are coming online with registration, it will say, have you received your vaccine elsewhere? Because, so we are trying to accommodate that as well, recognizing that, and I don't call that gaming the system. I think it's being reasonable about trying to figure out what's the best route for you to go.
But where we get that first shot, you should get that second shot there as well too, correct?
Correct. The question is, where I get my first shot, should I get my second shot? Yes, but more importantly, to make sure you get the same vaccine type. So that card that we're all required to give you, that is one federal thing that we all have to give, is a vaccine card. It's, I'm going to say for all of us who like technology, a little old school, that's your card. It shows you which dates, which doses. So for instance, I know we've got people that travel, and my challenge is I can't always, if again, vaccine shortage comes up or something occurs, if you've traveled out of the area and are planning to travel back in, again, these are challenges you're going to have to take. It's a risk, and making a plan. And so our goal, though, is to make sure that we can vaccinate as many as possible. I'm sure if you're in another state that they also are going to be doing the same thing. So how will they know which vaccine you got? They're going to show the card.
Going back to the national approach, do you know why we don't have one?
The question is, do I know why we don't have a national approach? Well, I think, all politics aside, remember, I think most times states are asked to make plans appropriate for their roles and their populations and their citizenry. I think we're facing one of the largest unprecedented challenges. We've said this before. We haven't seen a pandemic before. We've seen outbreaks in states, right? We've seen, different things occur at the state level. But I think our role in our government has often gone to local control, right? Where the local citizen have input. I think the challenge is when it rolls up to such a large scale where the locals then really become a national concern.
In our phase B, you mentioned how it's majority of the population is in this phase. Have you needed more staff to help administer the vaccine just across the board, like retired nurses and doctors coming back to help?
The question is, do we need more vaccinators? I'm going to just put it in succinctly. Of course we do. We have put the all call out, but I come back to most people have daytime jobs, right? So as healthcare systems have returned, so our medical reserve corps has been stood up. It includes students, it includes retired, it includes active that even on a weekend might be able to support us. So when I come back to, we are your locals, we are your neighbors, your friends, your colleagues, your residents. We are vaccinating you. We are coming together. Sometimes we've never met each other before, and we say, I'm assigned to work with you at the clinic, and away we go. And so that's why it becomes so important that, if you get an appointment, respect the appointment, try and get in at your appointment time, because that team has come together on your behalf.
reiterate the importance of that priority that you guys have created? Because I know there are some frustrations out there for those 65 and over and having to wait.
Oh, sure. Because if I do the math, right, and I say 5,000, and let's say in any given population, right, so within a 65-year-old, you know, we've talked about a little bit like who might be the most priority, right? So in a healthcare system, they may look to see how many comorbidities. And those are the comorbidities associated with higher risk of mortality from COVID-19. That doesn't mean every medical condition, right? So they may say, okay, I'm going to take the first group of 5. They're going to be offered appointments first, right? Because I've got limited doses. I want to make sure that those who are most likely. Then within mine, as well as the frontline workers, right? Because they're more likely to transmit to others. So if I've got individuals who are able to stay safely at home, right? And I know it's not fun sometimes, it's boring, it's inconvenient, but I might have to prioritize a transit worker over the 65-year-old with diabetes because this one is out, the bus driver's out in the public. That doesn't mean I don't think that one is better or worse. It's because this person is more likely to acquire and transmit versus this person who's staying secure, you know, really limiting their context. This person doesn't have that choice.
So in order to ramp up that 5,000 per week, is it a matter of getting more people to vaccinate, or are you getting up? Is there a plain supply on hand in order to do so?
It's a combination. So our health systems are building that in their capacity within their clinics and their, you know, services. Remember, during healthcare, we had to all kind of take care of each other, right? So, and then the second part is then making sure we have adequate supply of vaccine, because not only do I have first dose, I have to plan for second dose.
How many vaccines are the county doing a week?
Well, right now, you look on the site, and again, it's based on thing. I mean, in terms of number being done, we're averaging right now over 1,000 a day.
And at the rate that we're going, when do you expect us to be able to start vaccinating people in 1B?
No, okay, so the question is, when do I anticipate being able to start vaccinating in 1B? We are currently doing people in 1B, and concurrently while we're finishing out phase 1A.
Okay, when do you expect to finish 1A?
Well, that's, we've got about, based on our information and our registration system, we've got over 2,000 that are still in phase 1A. So we're continuing to work on that while we advance 1B. That's why we need our healthcare partners to work with us on the 1B, the over 65 1Bs. We are also concurrently going into some of these sites to vaccinate. So you'll start hearing about like the schools and the school personnel that are going to be vaccinated in their locations. Our partners have stepped up, places like Oak Street Health to help on this, are what we call our occupational medicine type wellness provider. So Marathon Health has stepped up to start working on City of Rockford, phase 1B individuals, and Swedish American Better Life Wellness is working on phase 1B county employees.
Dr. Martell, we talked a lot about patients right now in this 1B phase. As we know, so many people qualify for that phase. But do we know if there's a little bit more confusion or issues going into the registration process? Are more and more people reaching out because maybe they are in phase 1B, but of course with the priority, they're not sure. Just wondering of how it's going so far, if we're seeing a little bit more issues than 1A.
The question is, are we having more issues than phase 1A? And we are, because we did not use a registration for phase 1A. Remember, we said all hands on deck, the vaccine arrived, get going. And I mean that literally. We were vaccinating over the holidays, right? Phase 1B, they've registered, right? They registered around January 1st because they found out we had that link, right? And now it's January 27th and they don't have an appointment yet. And phase 1B started Monday, right? So yes, there's frustration. They're worried that their registration isn't there. We've confirmed that their registrations are there. But I keep reminding individuals, please be patient. We are going to get there, but this is a very large group that we have to begin to work on vaccinating. And our healthcare systems are working within their systems to, again, prioritize within the priorities.
So since 1A and 1B are both being vaccinated, is it possible that people in 1B could be getting their vaccines before people in 1A have?
And the question is, can people in phase 1B getting ahead of phase 1A? And yes, the answer is, depending upon what the system is and where they're at, that could possibly happen. It also could be that they didn't register till later as phase 1A. I know that there is vaccine hesitancy still out there in the community. I've heard before, a couple people say, well, I'm going to wait till so-and-so gets it, and if they do okay, then I'll get it. Or I'm going to see how that whole hospital, and again, I think there was a lot of stories out there initially about people, did they have to take a day off from work the second go around? We did not see that. So once that starts rolling, then we have more phase 1A registering. So that's, part of that catch-up is I think will be ongoing as more people decide to vaccinate.
Dr. Martel, as part of all of the healthcare systems, different clinics too that are getting those doses, Winnebago County Health Department is also a place getting those doses and administering. Have you been doing that so far this week for phase 1B?
For phase 1B, we've been working more on phase 1A. I told you we're working on the SILAs, the community integrated. We also are partnering with other facilities. So we did some work with our partner agency, Mercy Health, this week. So we had a combination of phase 1A second vaccinations, some phase 1B, and some new phase 1A. So, again, you can see the combination that's coming in to the sites where we are scheduling them to come into. And so we have also partnered things like with Crusader Community Health. We are doing different, Oak Street started their slow ramp up as well for appointments. So we are all working together to try and deliver as much as we can, as efficiently as we can, and as safely as we can. This vaccine, you have to monitor the individual for 15 minutes after they receive it for potential for anaphylactic reactions. So it's not like I can just let you go and walk out right now. I've got to sit you down, I got to watch, make sure you are doing okay before I release you. So I always call it like you're sitting in the penalty box for about 15 minutes before I can release you. So it's a little bit more, it's not like you can rush into a place, but I do want to make sure that people understand there are no walk-ins. No walk-ins. Let me repeat that. If you can't put it in bold, headline, whatever that is, because when a system has to deal with walk-ins, it can't deal with its appointments if they're having to spend time explaining. And every individual we've heard, we understand the stories, the chronic conditions, the loneliness, the isolation. I want to be able to see my loved one. We understand, and we were working as effectively and efficiently as we can to vaccinate.
How often is the county getting shipments and about how many doses are in there?
Well, on average, I gave you that, number, about 5. And again, we often don't know until midweek if we're going to get a shipment. And some weeks, like if it's a short week, or sometimes I'll hold a shipment if the weather's going to be bad so that we don't have, again, this is fragile vaccine, so it can't sit out on a loading dock when we have an ice storm going on. This is unlike any other vaccine we have had to date. So there's a lot more logistical challenges. But typically we receive weekly vaccine shipments, so we try to keep up. Remember, we have to plan for the first dose, and then I got to make sure I got second dose in 3 weeks if it's Pfizer and 4 weeks if it's Moderna.
I did have a question for Mayor McNamara. Mayor McNamara, hi.
Hi.
So we had talked a little bit about phase 4, being very excited about it, but we've also talked about in this pandemic, we've been in it for months and months, and you had mentioned those resources of how people can get help for utilities and mortgage and things. You had mentioned $5 million from the city to be able to help with that. Where was that coming from?
So question is, how is the city being able to assist residents with their utility bills, rent, and mortgage? So a majority of it is from the federal government to the state, passed through down to the city, and we're able to get those dollars out. Some of it has been our own existing CDBG, which comes from federal to the city directly. But it's typically pass-through dollars. And I'll say, and I know the chairman's not here, but thankful that Chairman Joe Shirelli in the Winnebago County has partnered with the city of Rockford and Aquanette Parham, our Director of Human Services. They're going to be bringing in about $8.3 million to assist with rent and mortgage assistance. So we know this is a major issue. This is a major issue with residents who are tenants, and it's a major issue with residents who may own 1, 2, 3 rental units that's their full income, or that was their retirement plan, and now they're not getting paid. So we are trying to make sure that these dollars assist, obviously, the tenant who's living there, but it also assists the landlord who owns that property.
And then also, just as a member of the public and also being at so many different public events, have you been able to get the vaccine yet?
So I'm not in Phase 1B. I think they have elected officials in like Phase 26Z. The second I'm afforded the opportunity, I think everyone should get the vaccine. Any other questions?
I have one last question for Dr. Martel.
Thank you.
Yeah.
What are your thoughts on the rate at which we are moving and administering the vaccine in Winnebago County?
So my thoughts on the rate at which we're administering vaccine in Winnebago County. Well, I'm like every other citizen. I'd like it to be much faster. I'd like it to be like this, and we'd all be done, right? Because, again, we know that this vaccine has been very effective, and it will allow us to return to a greater sense of normalcy. The challenge, and I came back to it, is I'd like to see, I'd like to see vaccine pouring in at a greater rate, as we know. I'd like to see people being able to get it and not have to wait a month after registering. But I come back to, again, we are using every available resource available to us to vaccinate. Anything else? Thank you.
Thank you very much.
I think we're